Dentistry in General Radio Network presents the Independent Dental Practice Podcast with Dr. Sonny Spera. In this episode,
welcome to the podcast, Dr. Sonny Spera. My guest, Dr. Lior Tamir. He is a super intelligent, bright spot in dentistry. He is the developer of the Dental app, which is a dental software program which combines a lot of business and a lot of dentistry, as well as helps you run your practice in a way a lot of dental practice management softwares don't. That said, today's topic is about a really clever way to try to make up the gap between what insurance pays and what your charge and your cost of delivering that service. And his focus was in hygiene. He's paying his hygienist about $85 an hour. That's their salary. And the reimbursement was around $80 for certain plans. And rather than go out of network, he decided to have an administrative fee. Not his idea, but an idea that he got from his daughter's pediatrician's office. So medical offices are doing this. Now, being very clear, what makes an administrative fee different from a membership fee? We cover that. What are the numbers? What is the break-even point? What did you expect to lose? What did you expect to see? What kind of revenue do you think this might generate for you? A whole bunch of other thoughts and questions are going to come out in our discussion. You don't want to miss it. Really enjoyable, bright guy. You're going to love him. Thanks, everybody. Appreciate you listening.
Closing the Gap, Bringing Administrative Fees to Dentistry. Dr. Sonny Spera interviews Dr. Lior Tamir from the Dental app.
Welcome, everybody. Dr. Sonny Spera. Today, our guest, Dr. Lior Tamir, who we have spoken to before. He's the inventor of the Dental app, which is a practice management software solution, which is really unique. It's cloud-based, and it's business and user-friendly, and it's dental-friendly, which in our field, as most of you know, it's either one or the other. It's either pretty good dental or it has a little bit of business, but rarely do you have both. And this is a dentist who has started from scratch. He'd been in the tech world and now is in both worlds with a dental tech, really. And his back practicing dentist involved in his own private practice, and he has his hands in a few other practices. So let's welcome Dr. Tamir. How you doing, Leo?
I'm doing great. Hey, thank you so much for having me on again. I know this was kind of a last minute thing. We got a lot of traction on that post that I posted, and there's so many people reaching out asking how it went about and just getting clarification on it. So I really appreciate you giving me the ability to share more and kind of talk about how this big change in my office came about.
Well, let's get into it. So what happened was Lior posted on a Facebook dental site that he had the dilemma of not making great money or even breaking even on his preventive fees or hygiene fees being in network. And there was a number of dental practices in his area that were going out of network with Delta Dental and then a couple of other ones. And he decided, and he looked into it, and he came up with what he wrote, what he called it a membership plan, but it's really an administrative fee. And we were talking a little bit before on, I called it an access fee. And it's not really your true membership plan, but I let's get into it. So let's tell everybody the genesis of the thinking, because I probably just butchered that. So why don't you
No, that's totally, this is, it's tricky. And I actually want to start off with just a brief disclaimer that I'm really not trying to give people legal advice or what to do in their practice. Everybody has to evaluate their own situation. And
hold on. Let me second that, because I'm not giving legal advice either. Trust me.
I think we're here to just share, different stories or just different ideas and concepts and how things came about. So the other thing I'll say is that I didn't come up with this idea, and I'll tell you actually how this came about. So, I practice in San Mateo, California, which is smack in the middle of Silicon Valley. I'm somewhere between, Palo Alto or Menlo Park, where Facebook is based or Meta is based, and then San Francisco. I would say a solid 85 to 90% of my patient base works at some sort of tech company, whether it's Apple or Facebook or Google. And most of these patients have insurances that are, MetLife, Delta Dental, and so on. And there's been this just huge trend of offices in our area going out of network for obvious reasons. Some things are just covered in it's hard to believe what we get reimbursed for some of these services. And I think that's just been a general trend I don't think it's just localized to our area, it's just across the board. In the last few years, my practice, as we were still in network, started to become more of a catch-all for a lot of these patients. So as practices were going out of network in our area, patients were looking for routine preventative care, and we became a catch-all for that. And in our office, we got to a certain point where we were so booked out, especially in hygiene, that we were being booked 7, 8, maybe even 9 months out, and not really being able to deliver on what we owe our patients, which is regular routine care.
So you had a capacity issue, and you had a potential, right, quality of care issue, because you're not seeing people that need to be seen on 6 months or that need 3-month recall. You don't have the place to see them or the space to see them.
Exactly that. And that's really where this conversation started. And a lot of what I was, contemplating was, I pretty much came down to two different options. It's either stay in network and either expand or go out of network. I've heard some really difficult stories on doctors going out of network. And I, was really trying to wrap my head around what were my options. And this all came to play. One day I opened up my mail, and I actually received a letter from I have a young daughter, from her pediatrician's office, an MD pediatrician, nothing to do with dentistry. And it was exactly this verbiage or administrative fee. And the letter said something along the lines of, due to the additional resources required to bill insurance companies and the challenges along with it, we are rolling out an administrative fee that if you want to have access to our physicians or our office, you're going to be required to pay that. And, in this case, it was $575 per child.
That's about $150 a month per child.
Correct.
Okay.
Correct. So when I received that is kind of what started this conversation and thinking about like, hey, what's going on? How is this getting implemented? They were, by the way, my pediatrician is still in network billing our insurance, et cetera. And so I did start thinking about this, contacted my attorney, and learned a lot through the process. And I think that there's a lot of nuance in how this gets implemented. But this is what I learned. The contracts that we have with insurance companies prevent us from being able to charge patients for services covered by insurance. So you cannot charge for additional fees for clinical care. So you cannot implement this as a clinical fee or a fee that gets them more cleanings or things like that. So the really big red flag is making sure that this is presented, charged, and represented as an administrative fee, or kind of like you said, an access fee. And the other thing that is really important is that you cannot make this particular only to people with insurance. So you have to roll this out in a way where every single one of your patients has to pay for this. So you cannot discriminate and say only patients that have Delta Dental have to pay this fee. It has to be done in a way where whether they're a cash pay, a in-network, an out-of-network, whatever they have, whatever they're doing, you have to implement this fee across the board. And those are the two big red flags that I was advised could get me into trouble. And there's a lot of logistics, how this is rolled out. You got to make sure that you get consent. And I know that we're going to get into that part, but I think there's a lot of activity saying, hey, how is this legal? And it really comes down to those two things. One, it has to be presented as an administrative fee. This has nothing to do with clinical care. This has purely to do with, hey, there's ongoing cost to bill insurances, operate this business in this environment. This is being presented as an administrative fee, and it has to be presented to every single patient. There's no, hey, this can only be for patients that are in network or out of network. And that's kind of a double-edged sword. And I think every doctor, every office has to really consider that part, because I did have some patients that were out of network and we were getting really good reimbursements, and they decided to find care elsewhere because this didn't suit them. And I understand that. But that is a decision that you have to consider. And those are some of the repercussions that can happen.
What did you charge?
So in our office, the administrative fee is $185 charged once a year.
Okay, that was my next question. They pay that once. Now, is the difference if they pay cash, check, or credit?
In our office, a few years back, we had implemented a surcharge for credit card. So they can pay cash, debit, HSA, FSA, and check and have no additional surcharge. But anyone who pays with credit card, the system will automatically bill them 3.5%. So that was implemented several years back. And again, similarly, checked with everything, presented it in a certain way, and made it very clear. And obviously, we give patients ways to pay where they don't incur that fee.
So 175, so approximately $15 a month?
Yeah, 185. So it's exactly $15 a month. It comes out to.
Right. Okay.
So yeah.
And you've been doing that, and you implemented this. When did it physically go into place? Because we got to talk about your preparation next.
Yes. So we officially turned this on August 1st. So we're 2 months into this.
2 months in. We're recording this the end of September.
Yes. And the important component is how this gets implemented. We put a lot of effort in really refining that. And we knew that this was going into effect August 1st. A few things that our attorney advised us, and again, you should get your own legal counsel and get advice on this. But the first one was we had to give patients enough time to make up their decision to either find care elsewhere if they weren't going to commit to this fee, or give them a proper heads up. So on June 1st, the first thing we did was we sent out an email blast to all of our patients announcing this change. And from the get-go, we put a landing page associated with this change front and center on our website. So on our main navigation, you could see a link. It says hygiene admin fee. It has all the details there, FAQs, etc. And we made this front and center. So I think that the general theme that I'm going to talk about is it's critical to over communicate this, right? You really want to come off as being transparent in this. You don't want to surprise patients. So first thing we did was we sent an email out. From there, the next thing we did was we used the dental app to essentially text every single patient that had a hygiene appointment from June 1st all the way to February 2025. So 7-8 months worth of patients. Each and every single patient received a personalized text message that provided those details. Come August 1st, this change is coming. This is considered an administrative fee. Here's a link to our website where you can learn more. If you choose to find care elsewhere, please give us a heads up and we will go ahead and cancel your appointment. So that was the second thing. The third thing we did was we then followed up with phone calls, right? Because we really just wanted to be over communicative. We didn't want to find ourselves in a situation where a patient said, hey, you know what? You didn't give me the chance. You didn't give me the heads up. That was not going to happen in our case. So first an email, then text message, then phone calls, and it's on the website. So by the time patients were coming in, we had tried diligently to, and I would say 99% of the patients got the memo.
Your phones had to light up in your office.
We had a lot of people reaching out. Yes.
Had to.
Absolutely.
Because this is something new, and it's a batch email, text, what have you, group message that's going to require some people to ask, right?
Yes. And again, I think preparation is all of it, right? Like the staff was trained. There was a narrative typed out. There was printed paperwork that associated with it that explained it. We really made sure that our staff was well prepared, patient, communicative, understanding, empathetic. I mean, this is not a real popular change at the end of the day.
Oh, no. It's taking more money out of people's pockets. Ultimately.
Exactly. And look, the reality is we lost 10 to 15% of our patients, but that was the intended outcome, right? We needed to get to a point where we could all of a sudden offer 3-month, 4-month recalls, 6-month recalls in a timely manner, have just some availability in our schedule. And it did exactly that, right? And so we did lose patients, but that's essentially what needed to happen. The final part to all of this, which really just is good practice to make sure that, as an office you're covered, is when patients came in, when it finally came time to bill them for it, we provided a documentation with written consent. So we requested written consent so that they consented to this and saying, hey, I understand that this is not billed to insurance. This is an administrative fee. This has nothing to do with clinical care. I consent to it. So we're collecting that. We're putting that in the chart. All of this legwork done to make sure that this is as transparent as possible, give patients the opportunity to go find care elsewhere if it's not a good fit for them. And we really did everything humanly possible to make this as seamless as we could. We did also, and I think this is a really important point for offices thinking about potentially rolling this out, is we did end up having a few patients, it's not many, it's maybe one a week, that come in and say, hey, you know what? This is still a surprise. I didn't read the text message. I didn't listen to the voicemail. I didn't. And in cases like that, what we do is we, let them know, hey, you know what? No worries at all. You're more than welcome to do your appointment today. We won't bill you for it. If you want to find care elsewhere, you're more than welcome to go after that.
Yeah.
And if you do want to continue and schedule here, we can bill you on the way out. And it's totally your call. So I think that having a certain level of leniency and just understanding and being empathetic is really important in making sure that you don't upset patients, right? So there's so much you can do.
But listen, leniency, well, it's you're being flexible. You're not really being lenient. You're saying, right, in my opinion, that you're being flexible, like, okay, well, you don't have to, we'll do this. And kind of like, you can do that, but if you're gonna stay, we'll take your payment on the way out. Like, it's not negotiable.
That's right. Yes. So I think that's, you said it better. We're not being
both words work the more I think about it.
Yeah.
But it's the truth that what I want to emphasize though is this is our standard operating procedure. This is how we practice now.
Correct.
So if you think about it, in 2 months of implementing this, you've made I'll call it a fundamental change in your practice. So if I'm going to make an appointment, I'm a new patient, I'm going to make a new appointment, my administrative fee needs to be taken care of before I'm seen.
Yes. And again, we communicate that to new patients, to patients scheduling, to, patients call in and say, hey, do you take MetLife? And our answer is, yes, we take MetLife, but you should know that we have this administrative fee that we implement. And many patients say, you know what, no problem at all. And some say, you know what, I'm going to find care elsewhere. So I think that's really what it comes down to. If you are being transparent about it, there's definitely steps you can take to make sure that you're within your rights, that you're not doing things to, and actually this is an even more important thing to say. We did have patients call their insurance and ask and complain. And we had insurance companies call us to get clarification. They said, hey, we heard about this fee that you're charging. Is it just to my MetLife patients or just
Correct.
to
That's the first question they want to know. 100%.
Exactly. And our answer is, this has nothing to do with clinical care. This is an administrative fee, and it's charged across the board to every single patient, whether they're a cash pay, in-network, or out-of-network. Yep. And then insurance companies have nothing to say about it. They hang up and we all move on with our day.
Because the one thing I would be concerned with is at the end of the day, let's say I'm an insurance patient and I pay and then I submit my insurance, or I have a deductible or HSA or whatever. I take that administration fee and I somehow submit it as a cost for me to have my dental care done. So I'm thinking maybe an HSA account or something, or whatever it might be, using that as an expense that I had for my dentistry. You know what I'm saying?
I do. And I honestly don't have guidance on that for listeners.
Well, this would be part of a good follow-up, right? After you've done it for a year. But
yeah.
The good news is if your insurance carriers have called you and you've made that clear, you would think they would be able to tell the patient, oh no, that's an administrative fee. That's not covered. That's not something you can submit to us for reimbursement. Now, I don't know if it's something covered. Like, I'm thinking about my medical insurance, you gotta make certain payments and you keep track of it. And then once you get to this point, your insurance changes, like I'm thinking a health HSA account, but I could be getting the terms mixed up. But it's one of those expenses that, okay, it's not covered, but it's used as your expense towards your deductible or something like that.
Sure. Yeah. Again, we haven't had pushback from insurance companies once they found out, and we've provided the details. And I think that's about as far as I can say, right? Like, I think at the end of the day, this is where I really want to draw the line and say, look, I'm not here to give people advice on what they should do in their practice or not. And look, even though this is pretty new to the dental space, there's proven models and many offices doing this in the medical space, right? So for example, I referenced in my post one medical group. One medical group built their entire business on this, right? You pay a, whatever they call it. They call it a membership fee, an administrative fee, and it gives them access to the office and the doctors and an app. And that's, I think one thing that's like, if people look at my practice, you can see the reputation that we have in the community. We really do deliver best in quality care. We provide pretty much a concierge service, but I'm always on call. Patients get access to my cell phone. People text me, email me, whatever. I've always found it to be quite easy to provide that level of care and hospitality, and patients really appreciate that. So in many ways, this is kind of like a concierge fee, but they're already getting that kind of level of care. And so, I think that every practice has to really self-reflect and say, hey, am I delivering that quality care? How is this going to impact me? But for us, it was a well worth it kind of gamble on whether this would work or not. And the outcome actually served the exact purpose that we wanted it to serve. We were able to free things up. Now, hygiene is not a loss leader in our business. So, for example, I think reimbursements for a hygiene appointment that MetLife Delta, it's like $81, $84. In the Bay Area, hygienists are making somewhere like $600 to $650 a day. So you're talking about $75 to $81 per day, per hour. So, getting reimbursed $81 and you're paying a hygienist $81, you're losing money because that doesn't factor in.
You're definitely losing money because you're not counting all the other costs of an employee.
Exactly, right? 401k and rent and liability insurances, materials, et cetera,
Social Security, SS,
Exactly. So this was something that we decided to do instead of going out of network. And so far, I think I'm really happy with how it turned out. And it might be a model that other offices pick up, and it's almost like a happy medium, right? We
interview a lot of folks who've gone out of network, and we talked at length to a lot of different doctors. That's one of the more popular that we put out was, how do you get out of network? How do you become less insurance dependent, et cetera? This is just another interesting method. So let's talk about the planning portion. So when you're planning this, you talked about, okay, there was 60 days that you started the communication, and you highlighted the email, the text, and the phone calls. So people were getting it in three fashion. Did you contact, just that thought of this just now, did you contact the dental insurance company, say, hey, this is coming up, if this is ever a question on your subscribers' part?
We did not, because it has nothing to do with them. It's an administrative fee. It has nothing to do with clinical care. That's a decision for each office to make independently, but it just didn't seem like it was necessary. We weren't advised to do that. And again, we really tried to make sure that what we're doing had no overlap or consideration with our contracts with them. And so it's really none of their business.
Yeah, when you think about it, if you just notify the insurance companies, they could say, well, this is biased because you're only notified us. Yeah, I'm just thinking, because they did reach out to you, might have been like, hey, we did send you a letter just to give you a heads up that you may have this question from your subscribers. Okay, so when you were planning it financially, what were you looking at when you did your numbers? Because I know you ran your numbers, because I know you a little bit, and I know you enough to know that this is not just although the genesis of the idea was the pediatricians, your family's pediatrician note, I'm sure you worked this all the way through in your system. So what were some of the calculations and some of the things that you came up with in terms of those numbers? What did they look like?
I think that is a really great question. So for what we do, or what I did, I think it comes down to scenario planning, right? And it comes down to how many patients can you lose before you have to start letting people go, right? And I think that is essential. So I created an Excel spreadsheet. I know my overhead. I know my break-even costs on cleaning. I know how many active patients I have, right? So I have analytics on all these things. I know what my average reimbursements for hygiene services. So I know my average, essentially, appointment reimbursements are. And based on that, I started doing math. Like if I lose 10%, 15%, 20%, 50%, at what point does it really start to impact the business and we have to reconsider this? And just using Excel and a bunch of different calculations, we're able to figure that out. And we did the math that if we lost 30% of our patients, we would be totally fine. And it would still allow us to maintain our staff because of the additional income coming from this admin fee.
So say that again for people that might not have been totally alert. What was that number again?
30%.
30%. So an average hygiene J, let's say if they see 10 patients, that's 3 people. If it's 8 patients, it might be
4 people.
Right?
Pretty much. Let's say 3 patients a day didn't show up or canceled, we would still be okay because of the additional income coming in. And that was our kind of red flag. Like if we go past that, we really have to reevaluate if this is a smart plan and if we just scrap that idea and go completely out of network. And so, we knew going into it, that was our big number. And we were tracking. We tracked every single patient that decided to go elsewhere. We were tracking our availabilities. We're tracking how many people consented to it. We're tracking, how many are changing their mind last minute. We're tracking how many patients we're losing that were in network, out of network, and cash pay. So we had detailed kind of note taking or getting records of all these details as we rolled this out. And we just knew that was our big red flag number, that if we lost 30% of our patients, we really had to rethink this.
So to date, you said your number is right around that 10%?
Yeah, it's somewhere between 10 to 12%.
Okay.
Again, we're 2 months into this. And I think that when we go through a full 6-month cycle and we kind of go through our entire patient base, we'll have a much better understanding how this impacted. But we lost a bunch of patients, so we had a bunch of openings, and now we're back to a situation where we're filming this end of September. Coming up in October, I think I have 4 availabilities in hygiene, and I have 3 full-time hygienists. Or it turns out to be I have 4 hygienists, but not each one is every day.
Yeah, I got you.
Any given day, I have 3 hygienists in the office seeing 24 patients. So that's a lot of patients that agreed to it and are sticking with us. The majority did. And I actually posted a review that we received. Some patients were upset and left. Because we were so transparent, we really didn't get any negative reviews online because of this. And I think that's a really critical part, because you don't want your reputation to come out and be like, hey, these people are super shady. They kind of sprung this on me last minute. Because we were so communicative and we over communicated. And in cases where patients were like, hey, you know what? They're upset. I didn't find out about it. I don't read my text message. It's your fault. In cases like that, again, we just waive it and see them and then off they go. Because we did it in that way, we didn't get any negative backlash. We did, however, see a bunch of really interesting things. Some patients posted about it on Yelp and on Google and said, hey, you know what? For top-notch care, I'm willing to pay. The guy had said it on that post that I included. He said, I'm willing to pay what is essentially a Netflix subscription. Right. So when people put it into context that way, those are some of the things we saw. Other things that we saw were like additional WhatsApp groups and Facebook groups, like mom Facebook groups and communities. Patients brought it up like, hey, they have a new admin fee. And we saw plenty of people say it's totally worth it. I would hands down continue to go there because of the quality of care that we get. And again, I think that what is happening in our area, we're in a relatively affluent area. Patients are realizing that $185 out of pocket is still a lot less than if they go to a out-of-network Delta dental provider and they're paying $500, $600 for their first appointment with x-rays and $250 for the second appointment for hygiene, right? So I think our patients have really resonated with this, and because we've explained it in this specific manner, most of them decided to stay with us.
Okay, so the 30%, what does the revenue look like that's coming in? Because now, quote, it's a new source of revenue, and you have to track it differently, I would assume. How are you handling that on the administration side?
So, shameless plug, on the dental app, we did all of the communication this way, so we can batch process communications, text messages, emails. We're even tracking phone calls, so all the communication happened through our software, but we did create a custom code for it, right? So you're able to create a code that's not built to insurances, and you're able to track it just like any other KPI in our system. So we're able to see on a monthly basis, or you can customize the date range, how many of these codes are being billed, or what does that make up in the production. I will tell you that, again, when the dust settles, this impacts the bottom line somewhere in the range of $300,000 to $400,000. So it's a significant chunk of money that ends up being pure profit, right? Or to offset some of the losses of hygiene. And I think a big part of that is also, what do you do with that, right? Reinvesting in the experience, reinvesting in your team, being able to. We recently ordered air polishers. We're taking a lot of that money and reinvesting it back into the office, but at the end of the day, it is profit, right?
Yeah.
And it more than
money you weren't getting before, right?
Exactly. And it more than makes up the losses that we were having in our hygiene department. It actually makes hygiene exciting, right? Like now, instead of just being a part of the business that is a necessary component of providing clinical care and is really just a loss leader. I could definitely, I aspire to now having more hygienists. I mean, I'd love to get to the point that I have 5 full-time hygienists doing this and providing this, this service with this administrative fee.
So how do you administer it? Is it calendar year? So for example, if I'm coming in October, I pay my yearly for October. Then in the next calendar year, if I come in 6 months later, I come in April, I pay that fee again for the following year?
No. So because it's a fee, it gets completed and it gets attached to the patient ledger, right? So it's very clear to see when a patient came in and when they paid for it. So for example, patients that paid it in August of 2024 won't pay it again until August of 2025, right? So they come in, they paid in August, they come in for their next cleaning in whatever, January, February, or whatever the recall schedule is, and they don't pay it again until the following August. So when they pay it once, it covers them for 2 hygiene appointments, or gives them access to 2 hygiene.
So you should have a reasonable, because our membership fee, right, is yearly. We expect to see more in the first 2/3 of the year.
Sure.
Versus the last third, because it covers their 2 cleanings. It's only for non-insured patients. It's under different guidelines and different usages.
And by the way, in our office, we have a membership fee for patients that have no insurance.
Right.
And what we did is we did not increase that fee. Our membership fee is $375 a year. And in our office, it covers 2 basic, prophies, x-rays, all their exams, and then 25% off dental care. What we did is we lowered the price of that by $185. So the $375 includes the membership fee plus the administrative fee.
Wow.
And that's how
25%. You're a generous guy.
I think that the thing about membership fees and being a network, I do think that there's a lot of really fantastic patients that are police officers and teachers and people that don't necessarily have the means to pay or go to out of network. And it is a way for us to still continue to deliver high quality care, make it accessible to people that don't always have the means. So, it's just what's worked for us, for my office.
Okay. All right. Well, a couple of questions that I had, we already hit on, right? Was kind of about the break even, the percent loss, and the revenue generated. So has there been any other unintentional benefits?
Yeah, I think we've kind of covered it all. I mean, we didn't really have a choice. We had to do something. I think that you very quickly learn who values what you're doing and who doesn't. I had patients who were patients of mine for 7-8 years, and they ended up leaving after this. And it was kind of like a shocker. And by the way, these are patients where we've bent over backwards to do things for them, come in,
of course,
accommodate their children's schedule, stuff like that. And they're like, I'm going to go find care elsewhere. So there's that aspect of it that, it really opens your eyes to who really values what you're doing. But I think that in general, it's a very rewarding feeling to hear patients say, hey, you know what, I really appreciate what you do. I understand why you're doing this, and I'm sticking around. This is still worth it for me. And I think that there's a lot of thought that we put into coming up with $185, making it $15 a month, when you're able to say, hey, you know what, it's really just $15 a month. It's everything's gone up in price so much, to be able to continue to deliver care at this level for an additional $15 a month is a pretty nominal fee for most people. It's definitely a shocker. Many patients were shocked by it, but it was very heartwarming and rewarding to see people say, hey, you know what, I'm sticking around. I think that is a really nice outcome. And to be honest with you, I think we're going to find ourselves in a really tricky situation in about a year, because we're getting plenty of new patients, and these new patients are well aware of this administrative fee. And we're going to find ourselves in a situation where we either, again, have to expand our footprint, find a bigger office, build out something larger, or see how else we can continue to keep up with the demand for the services we provide. And I think that's a testament to the role we play in our community.
Has any of the hygienists come forth and say they want to raise?
My hygienists were well aware that we were losing money keeping them on our team. In my particular office, I have the 4 hygienists. One drives 90 minutes to get to our office. One drives over an hour to get to our office. One drives about 30, 40 minutes, and one lives close by. So most of our team travels to our office, and so and by the way, this is a totally different conversation. I believe that if you want to have a best-in-class practice, you got to take care of your staff in a best-in-class way. That's the culture you got to develop, because your staff is a reflection of you. And if they're happy and they love what they do and they love what they have at your office, and they pick to work at your office over other offices, then that's going to reflect in the service that they provide and the experience that patients have. And so to begin with, we're definitely paying in the 99th percentile in our area. We provide very, very competitive benefits, better than pretty much any office in our area. So I didn't actually have my staff bring any of that up. And I was very open about it and say, hey, look, right now we're kind of losing money on hygiene. When I pay you $78 an hour and I get reimbursed $81 an hour, by the time I factor everything in, I'm losing money to provide this service. And so I think there was a healthy level of communication around why we're doing this with our staff, how we rolled it out. Again, this goes back to how we trained our staff, how we talked about how to discuss it, really try to keep clinicians out of the conversation and leave that to the front office or administrative team. And again, our staff is also seeing us reinvest, some of this additional money coming in into making their jobs easier, et cetera.
So people understand what you're comparing their pay to is the Profi code, adult Profi code.
Sorry, say that again.
So when you're saying that your reimbursement is $80 and you're paying them $81 reimbursement for.
Correct, adult Profi.
Adult Profi. All right,
Yep.
So child Profi, a little bit less.
A little bit less, correct.
Food for thought. I think it's a different approach. Certainly a little bit outside the box thinking. It takes what at least I have, and you have also membership plans, and it's a little different spin, but it's not the same thing. It's clearly not the same thing, and that's the emphasis. And I think you clearly outlined it too when you looked at your membership plan. You changed your membership plan fee to now have the 2 separate parts.
Correct.
So when you add them together, because each person has to have the administrative fee as part of their access to see you in your office.
Exactly. So if we were to just summarize this, is got to be an admin fee. It's got to be to all patients. You really need to over communicate this and you need to get consent. And if you do those 4 things, you can do this in a way where you are not putting yourself in jeopardy and you're not doing things that aren't allowed. And again, you should go out and get your own set of legal advice and decide if this is something that you want to do for yourself or not. This happened to work really well for my office. And to be honest with you, I think we're going to see a huge trend of this kind of stuff coming up. I've already seen in the posts, other people say, hey, my office does this, or I've been in an office that does this. And again, we're seeing this in the medical industry. And I think medical industry has a much bigger challenge where they don't really have procedures. If you go to an average pediatrician, they don't have procedures that they can offset some of their overhead with, right? So they're really stuck in a situation where, they're providing their knowledge as a service, and just with wages, et cetera, it's getting harder and harder to run these, just practice medicine, whatever different part you're in. And I think that we're going to see a big shift towards services like this.
Well, I think I'm going to put a little plug in for those people that drop insurances also. I think in the medical and in the dental, and what you're basically seeing is a lot of times when you're in network and you're accepting their fee schedule, it's not covering your costs, bottom line. And as things change, because the one thing we did talk about, you were fortunate enough to receive a little boost in your reimbursement with insurance, because I think it was, you said some of your surrounding offices were starting to get out of network. But I do think it's telling the lack of really the disparity between what it actually costs to provide medical or dental care and then what the reimbursements are being allowed from insurance providers.
It is always going to be the big challenge in practicing medicine or dentistry. I agree with you. That is probably the biggest burden for most offices. And definitely what we do is not easy. And I think that your entire podcast and focus on, going fee for service and taking that approach, you've become such a great resource. I know so many dentists listen to what you say and hear about what you're talking about and really get a lot of advice from this. I hope this was useful.
Yeah.
I really appreciate you giving me the opportunity to talk about it. I knew it was going to be a controversial topic when I posted about it.
Other providers and other professions, I'm sure the veterinarians are going to be doing this if they aren't already.
Sure.
Medical is, but the necessity is the fact of the reimbursement not aligning with the actual cost to deliver the service.
It's exactly that. And again, for us, it worked out. The additional revenue coming in more than takes care of the lack of reimbursements, and is a real happy medium in our case for staying in work and continuing to deliver best-in-class care.
100%. Well, I appreciate you as always. Very thought-provoking and new. It was enlightening, I'll say, for a lot of people. It was for me. Because when I first saw it, I focused on the word membership plan, and I just said, how can that be? And if it's all across the board, because our membership plan, as is yours, has to be for non-insured patients.
Sure.
And we've had a couple patients that we found out were double dipping, and we said, nope, you're off the plan. And one of them we found out because his wife called and said, yeah, I need that for the insurance. We're like, we don't have him having insurance.
Right.
But, it's like, oh, okay, well, if you have insurance, you're off the plan. It's clearly outlined. It says it clearly. We'd go over it all the time. And that was one thing our attorney advised us. It has to be very distinct and very clear in New York State that's how it had to be, administered.
Yeah.
Well, I appreciate it.
Thank you, Sonny.
Thank you. Appreciate everything. Have a great day.
You too.
This has been a production of Dentistry in General Radio Network. Visit our website, dentistryingeneral.com, to join engaging clinical and business conversations, explore our dental podcasts, and stay updated on our upcoming live event.